They tried to take my blood pressure, and I had to start screaming because it was hurting so badly. I can't show you how blue it is, but my whole arm looks like I've been in a fight.
All the way around. And they really didn't want to stop.
Get on the ball, doctors in the medical field, please. Sunday,
Yep, it is.
59 degrees. Cold,
Where are we?
windy, bleak.
We're in Newport, Rhode Island.
Newport.
Yep. Okay. So, we're going to talk about the difficulties of going to the emergency room, right?
Emergency room was really very, very difficult. They tried to take my blood pressure, and I had to start screaming because it was hurting so badly. And I'm sure there's another way to take your blood pressure, since I know a little bit about medicine, having come from the University of Virginia Hospital. So, there you go.
So the problem is that
I can't show you how blue it is, but my whole arm looks like I've been in a fight, and I sure haven't.
I'm going to put some...
Just a fight with the taking my blood pressure.
I'm going to put some video of that in so they can see it, so they can see what it looks like. So we're going to take, this is day 2, the day after, right? Day after. This is from trying to take blood pressure with the machine at admittance at the emergency room. That's the bruise all the way around. And they really didn't want to stop because they said they needed the blood pressure reading, but we made them stop. And this is the one from the day, 2 days before.
That's getting better.
This one's getting better. That's 2 days before at a different hospital, emergency room. And she's not on any blood thinners. Just a product of age, I guess. So you don't want them to do that again.
We got to do something about it. And they've got to really make a study of people over 90, because their body changes and they have no control over it. You touch me sometimes, it hurts. I don't know why, but it does. And they have to really pay attention, because they're going to really be more people living longer, I think. I believe. Because we have better food and we have better care. So there you go.
Right, so
Get on the ball, doctors in the medical field, please.
So
Stop grabbing money. Think about the patient.
Right. I'm going to describe the problem a little bit more detail, okay?
Oh my Lord, it was so excruciatingly painful. She did it 3 times on my arm. It's black and blue. My son took pictures of it. I can't show it to you right now. But, oh my, it was, and she wouldn't stop. Finally, my son said, don't do that. If he had been there, I don't think I'd be living, because I couldn't stand the pain.
Wow.
It was just that bad.
Okay, so it's very bad.
And I certainly have had a lot of pain in my life, having babies, which I should have had, because I was so little. And, I mean, preemie.
So the only way they can really take it where it doesn't hurt as much is if they use a manual
Yes.
blood pressure cup, and they have to use a small one, a child one. So if they have that, and then they're in control, and the machine is not in control, then we can take your blood pressure. But by the time you're in the emergency room and they take your blood pressure, it's skyrocketing because you've been screaming from being in pain.
No. Well, why wouldn't it be high in the radical, upsetting situation you find yourself? Everything is high. Everything changes.
So we work with your cardiologist, and they want you to have, we've targeted a slightly higher than average blood pressure, because in people, elderly people, especially way up in your age group, It's more safe to have a little high blood pressure because the low number can get too low, and then you can faint and fall.
Yes.
And that was happening with you on the smallest dose of blood pressure medicine.
Right.
Your low number was getting very low. You were down to 100 over 60, I think. So we don't do that. It does run a little high. We have to be very careful. But yeah, so that's the one problem. Now the second problem you have every time you go to an emergency room is trying to get a blood sample or put in an IV to be in the emergency room. A lot of times you have to have an IV for a drip, right?
Yes. And I have a very difficult time because my blood vessels are very small. And when I fell and broke my left shoulder 2 years ago, I lost 20 pounds, mainly because I couldn't eat or swallow soup. The only thing I could eat was chicken noodle soup. And I started taking Q10, and it really pulled me through.
You're not on any blood thinners, but we take a baby aspirin.
Yes.
And we also do take some oils, like vitamin E, vitamin D.
Because the polio shot that I was taking, they didn't give it to me for 3 times, and it created a serious problem in calcium. So my body demanded calcium and took my teeth.
Right, so we think that your shoulder broke. You didn't really fall to break your shoulder. You were in bed. I think you just moved in bed.
Yeah.
And you broke your shoulder. It's a clean break, which they didn't do any operation on, obviously, because of your age. But, so, the calcium thing, yes. The Prolia shot, which is a bone density shot you get twice a year. You have to be very careful. You can't stop it. And unfortunately, we had to stop it because the copay was $700.
Right.
And
because they didn't want to pay for it.
Right. So when that happened,
a copay, whatever you call it.
Right. So when that happened, you lost your teeth, which is making it very difficult for you to eat, which is also a problem.
And now they don't want to do anything because I might lose my jawbone if they pull the roots.
So one of the side effects, rare side effects of the Prolia shot, is that you can get rapid bone loss. Say if it was your teeth, it would be your jaw or anywhere. It doesn't happen very often, but who wants to take a chance on losing your jaw?
Yeah.
So we're at a crux with the dentist, but that'll be a different day.
They don't
so we go and get back to your trying to get an IV. The hospital from Wednesday, which was 3 days ago now, you were admitted, and 2 hours later, they hadn't even taken a preliminary blood sample for a blood test screening because they had called up the lab because they couldn't get an IV in you or just to get a needle in you because your veins are weak, they blow up easy, and they move around a lot because you don't have a lot of muscle, right?
Right. There's nothing I can do about that. But what they can do is when a patient like myself come in, they need to really use the equipment that they would use on a small child because that would be more in keeping with my delicate situation.
Well, one of the hospitals you were in, once you were admitted, this is earlier in the year, you were admitted for a day, and they had a ultraviolet, I think it was, machine that allows them to target your veins more accurately, and that was a godsend. So this time before we went down there, we talked to the nurses, and we let them know about the fact that you have this problem with the blood pressure reading and also with the veins, but he was very good. You have to admit, the young man who took your first sample, he had a problem with one vein, and then he moved on, and he did it perfectly. So it's not, it's a very challenging situation for any of them. We've had 3 or 4 nurses at a time try, and then eventually a senior person will come down where they're from someplace, and they'll be lucky enough to get. So those are 2 of the major concerns we have. So I would say that when we decide in our decision making like this time, call up a nurse that's on call because it was a weekend, to talk to them about the particular situation, why we think we want to go. One of our biggest considerations is they're going to have to take your blood pressure. They're going to have to try and find a vein. And it really weighs heavy on whether you want to make that commitment, because if it goes wrong with, especially with trying to get a vein, that can be bad. So these are things that you should be really concerned about, the immediate cause if you're wanting to go to the emergency room, not just taking blood pressure. So I don't know what we're going to do. I'm going to try and get the manual, maybe I'll try and get a brand of the manual blood pressure thing and just keep it with us when we go to the emergency room. So we have it there, right?
We have to do something. It's not only just for me, it's for other people too.
Well, that's the reason we're making the video. It's not about you in particular, and certainly everybody's going to say everybody's different. This is not a situation. But I believe that people in the 80, 90, and 100 are going around.
Okay,
100-year-old range and over. I can't imagine that this isn't a problem with a lot of people.
Oh.
And the nurses will hit you at the door, maybe younger, and they really, the one that was yesterday, she just was thinking that you were just complaining and she had to motor through it. But, you know, motoring through it, massive bruise.
Well, the thing is, she's young and inexperienced and has no dealings with the elderly. So that makes it doubly hard. And we have to address it. And I say we, and I mean
medical industry.
Our medical situation has to address it.
And by inexperience, we mean 5 to 10 years, because we're old. We're used to people who have done things in our own careers for 40 or 50 years. So that's what a senior person is to us.
And who knows?
Not 10 years. That's a
Maybe God is directing me in this. I don't know. For some reason, I'm not doing anything unusual to live longer, but I am living longer. And my brain is still working, and I'm still somewhat active. I take care of all my personal needs.
You do.
So that's very good. Mm-hmm. And,
there are a lot of things about diet. Our challenges on gaining weight are just sustaining the 90 pounds that you are, 92 or 3 pounds. There's lots of things about the vitamins we take that we want to do videos on, just to share. It's just a one person. We're not doctors. It's just a one person, right? We're just one person trying to get through it.
Right.
But I found when we had problems, we look on the internet and we'd pick up cues from all kinds of people. Everybody's experience is valuable. You don't have to do exactly what they do, but it adds more layers of information to each person's condition. You take a look at our condition, even if you're 20 or 30 years younger, if you're not, you know, it could apply, it could help. Anything that helps is worth putting on YouTube or anywhere else. So people can really try and help each other, because the hospitals go by a certain protocol. I mean, the nurses are doing what they're supposed to do. You can't get into the emergency room without getting your blood pressure taken. I understand that. They have to take some samples right away to see all kinds of conditions. If you had a heart attack, there's all kinds of things that are in your blood that give them information right away on the conditions. And so they have to take your blood. But when taking your blood takes 45 minutes to 2 hours, you went to that emergency room and your net blood was never drawn the day before yesterday. 2 days ago now. But so that's that's how difficult it can be. And
well, Dr. Anthony found a way to get my blood sample.
Yes.
And but see, he was very patient, and that's the secret, really. So there you go.
So and we were lucky because the hospital we were at before that, where they weren't able to get a blood sample and they weren't able to get somebody from the lab, they called the lab department to come down and do it because they're a little bit more specialized. And then they were all sort of getting a little pushed. We were actually in the emergency room by then, back in the different rooms. and they were just going to put a big IV in there for a drip, and they were just, and the doctor left. Finally, the doctor came over and he was like, whoa, 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 whoa. We won't go into what we were checking for, but he said, let's just check and see if there's a problem here before we go putting this woman through all this. And he was able to check her and find out that we were going there to be careful.
Yes.
And he could tell right away that there was no actual situation in which you needed to be admitted. And then you were able to go home.
Dr. Pellegrino,
Pellegrino, he was a fabulous doctor.
No need to stick her with all that stuff.
He's a gentleman.
This video is for general information purposes only. The content seen or read should not be used as medical advice. No doctor or patient relationship is formed. Use of the information or links on this video or channel are at the user's own risk. This information does not substitute medical advice, diagnosis, or treatment. Please seek medical advice, diagnosis, or treatment for any medical concerns, big or small. Please do not delay seeking such help based on content of this video or channel.